Welcome. Today we are interviewing Dr. Jason Stevens. Dr. Stevens is a doctor of clinical nutrition and is a registered dietitian nutritionist. And we're focusing on prostate health, pelvic health, erectile function in this conversation with Dr. Stevens. Dr. Jason Stevens, we are very grateful that you're here. And I know that you have a well rounded approach and a lot of great thoughts about diet, erectile function, and I just want to get right into the questions. And the first question is just sort of taking a 5,000-foot view of erectile function, diet, and lifestyle decisions that men make. Can you just speak to that and just kind of give us just a big picture view before we dig into some of these other more specific areas?
Yeah, that's a great question, Andy. And thank you so much again for having me. I think that probably the most important point I would make from the top is that diet plays a role in pelvic health. I think it's a hugely overlooked area of practice in the field of nutrition. So I was reflecting on this before our call and thinking of how my journey got me here, because it's not like I was sitting in class going like, I think I'm going to be the nutrition sexpert. I think I'm going to go into men's pelvic health. Nobody was talking about it. I literally learned nothing about it. Well, let me correct myself. I learned a lot about it in that nobody really called attention to the link, and the things I was learning about are directly tied to pelvic health, erectile function, and prostate function. We just weren't talking about it. And that may be a bias. There's several layers of this, right? I think it's that one within my profession of dietetics. So as a registered dietitian, nutritionist, there are very few men in our field. So it's a bit of a blind spot, I think, from that perspective. I think that there's a cultural shame and stigma around erectile function, sexual health, pelvic health that creates another barrier to this, right? But the things that are effective for improving erectile health, sexual function, and pelvic health are things that we're already talking about, which is improving your cardiovascular health, improving your blood sugar control, improving your blood pressure, the role of inflammation and weight and hormones. Those are all things that we have knowledge about. It's connecting the dots, right? And bringing these things to people's attention.
In this space of erectile function and pelvic health, first of all, we are men. So, like you said, there's a shame that's attached to it. We don't know how to talk about it. We don't. So, what we do is just we go to what we think we know best how to do, how to fix it. And
Right.
in our case with Tim Medical, it's just get a vacuum erection device and don't do anything else. Just use that and you're going to be great. And what you're saying is you got to take a more well rounded approach, more holistic approach to your erectile function, prostate health, pelvic health.
You got it. A whole person approach. And I think that looking at each person from a comprehensive angle is really important. So in my work, so I am a registered dietitian that works specifically in men's pelvic health. And to my knowledge, I'm one of the only practitioners that specifically focuses on this. And I think that being able to take that bird's eye view for every patient and say like, hey, it's not just this one thing. And something you said that I think is important is I think men in particular are guilty of this, and not the stereotype, but we do sort of look for that. What's the easy fix? What's the one thing I can go grab and do and fix this problem? And especially when there's all this shame and stigma attached to it, we don't want to think about it. So let's just push this issue as far away as possible and grab the easy thing.
It's a lot of work to pay attention to diet. It's a lot of work to change lifestyle. And sometimes we'd just rather not do the work. So, what's the
Right.
solution? An oral medication, an injection when it comes to erectile function, a vacuum erection device, rather than those are part of a larger whole. So, I think that's very important. I know that you've talked about pelvic health. In our case, we have a lot of patients who are also struggling on the prostate health front. And many of the patients and customers who use our vacuum erection devices have already gone through a diagnosis of prostate cancer, treatment for that diagnosis, whether it's radiation or a radical prostatectomy. If you're talking to a patient who has not yet been diagnosed, and I'm not saying everybody will be, how can diet contribute to a healthy prostate?
Yeah, that's a great question. I think that these are things to consider from, again, a holistic lens, right? Is that nutrition, lifestyle factors, these are all things that can influence the health of our prostate, which is an organ that relies on blood flow and nutrients to be healthy. And some specific nutrients that we know are linked to a healthy prostate could be things like zinc, selenium, omega-3 fatty acids. And there are some protective factors in food, things like lycopene, some of the phytoestrogens that are present in soy that may have a protective effect on the prostate. But then it goes back to looking at that sort of patient by patient kind of perspective, right? It's when I work with the patient, I kind of take their whole health history and then I think about how does this fit into what your current treatment regimen is, what other medications you're taking, what other lifestyle factors you have going on, and then wrapping that into that. And so there are some general things that I think like any guy who's concerned about his prostate health can begin to incorporate. And then there are kind of the more specific things that I would say, like, okay, on a case by case basis, let's look at how these things kind of factor in, if that makes sense.
That does make sense. And I do want to talk about that, maybe some scenarios or, and I know what I appreciate about you is you are not one approach for every man, for all men. It's one approach for the specific patient I'm working with.
Right.
And so I do want to talk about that in a moment. But just from a general standpoint, a general health standpoint, there's no one diet approach to eating that's going to make sure your prostate's going to be the healthiest prostate on the block. It's more of,
Right.
let's look at the whole person.
You got it. Yeah, I do wish that we had this sort of nutritional equivalent of the one ring of power, right? The
Yeah.
one diet to rule them all. And I think that this comes from some humility, right? So I've been in the field for 15 years, and I think that part of my own journey, and we could talk a little bit about this too if it's helpful, and like how I got into men's pelvic health as part of my own journey. But I think that one of the things that I have to practice as a clinician is some humility in that as a species, as humans, we are adapted to a wide variety of diets, right? I think the thing that we're not well adapted to is a current sort of like high processed food environment that we're in. But there tends to be this, and you'll see this a lot with like social media influencers and people who are kind of big in that scene, is that they'll pick one specific diet that they're really excited about, and then they'll push that out to everybody. So whether that's
Yes.
keto or paleo or carnivore or vegan, like on the whole other end of the spectrum.
Yeah.
And the truth of the matter is the evidence is really clear on the things that are actually effective from a nutritional perspective. And none of those things are those, right? It's stuff that is not going to blow people's minds. It is not sexy. It is not earth-shattering. It's
Yeah.
move more, eat more fruits and vegetables, eat less processed food, eat less animal foods. Um, but
Yeah.
again, I think you also have to look at every patient individually and to come to those encounters with some level of humility and empathy too. Of, I work with patients who maybe this particular diet is working well for them
Yeah.
and they don't want to change that. And I need to figure out how to adapt, what I'm recommending to what that particular dietary pattern is. And also acknowledge that I don't know everything, right? That
Sure.
there are particular ways of eating that could be perfectly healthy that maybe just isn't literature to support that, right?
But we've kind of gone through the bigger picture view. We've talked about the prostate health. Now I would like to get into the pelvic health and how that important that is from a dietary lifestyle standpoint. If you could help me understand that better, especially, I'm talking all men, we need good pelvic health, right?
Yeah.
And I think a
Yeah.
lot of the men we work with also struggle with urinary incontinence as a result of
Mhm.
the prostate being removed and some of the other struggles that they're facing. So anything you can give us on that front would be very appreciated.
Absolutely. Yeah. So I do work specifically with Dr. Susie Gronsky's practice. So I'm part of the interdisciplinary care team that includes myself, Dr. Gronsky, who is a physical therapist, doctor of physical therapy. We have a mental health practitioner. We have an occupational therapist. And so we take this kind of comprehensive look at men's pelvic health. And I think for me, I tend to think of this as sort of buckets of, four major categories of issues that men could have around their pelvic health. And that includes pelvic pain, digestive concerns, urinary concerns, and sexual function. So if you want to sort of take it down to an easy, I call it the four P's. So pain, pee, poop, penis, right?
That
So
works.
they're the four P's of sexual health, right? And I tend to be a little more casual, especially when I'm talking with my patients, because these are issues that I think we need to be open about talking about making men feel comfortable about talking about these things, that this part of their body. And when you arrive, I think especially when you've had a history of issues in this part of your body, there's a sort of duology that happens, right? That this, anything that involves sexual function, urinary function, digestive function, your brain is wired to put a huge amount of importance on those functions of the body, which means the stakes feel really high.
I would like to take a pause in this interview and just draw your attention to timmedical.com. You can go to that website. You can see any number of vacuum erection devices that we manufacture, that we offer for sale. You can also see all of the accessories that go with those vacuum erection devices. We have on this YouTube channel over 50 videos to teach how to use the device, how to troubleshoot, and just encourage you to check those out. And if you use the YouTube 15 in the coupon code when you buy something from the site at any time, you'll save 15%. Let's get back to the interview.
And yet the level of shame or embarrassment around those things is also high. And that's a recipe for emotional pain and distress.
Sure.
And I think if we can treat men with compassion and empathy and comfort and just get them to feel like, hey, I'm not alone in this. This guy's got experience talking about this. I can feel comfortable talking about these issues. He's not going to bat an eye about it, then their guard kind of drops to the point where they can feel comfortable. And I think just easing that emotional pain is huge. And so, sorry, I know I've kind of gone circular around these topics, but we could spend a whole episode talking about each one of these buckets, right?
Yes, we
But
could.
I
Yeah.
kind of tackle them as they come to me, right? So a patient who shows up who has had, say, a radical prostatectomy, maybe dealing with one or all four of these issues, right? And so I kind of tackle them one by one, but they all interconnect. So the health of your digestive system is going to impact the health of these other systems around them. Think about them as neighbors, right? That the nerves that innervate your digestive system, they go right through the whole pelvic floor, but they also talk back up to the brain, right? So there's sort of this super highway of
Yeah.
signals that are going both directions. And so I don't like to think of them as necessarily separate entities. So if a patient presents to me with pelvic pain, for example, I'm going to ask them about, their digestive function, their urinary function, their sexual function, and think about how I can connect the dots between these things.
When we think about just the diet and the interconnectedness of it all, what you're saying to me is, you can't just focus on one. You got to realize that all need to be included in it. And diet being one of them, lifestyle being one of them, exercise, movement, another part of it, the emotional side of it. This is complicated stuff, man.
It is really complicated, yes. And the catchphrase, and I'm fairly certain I got this from Dr. Susie, but I'm gonna steal it from her, is we have to embrace that complexity, right? That we shouldn't shy away from it just because it's complex. Also, doesn't mean that the solutions have to be complex. Sometimes the answers are fairly simple.
Yeah,
Just so, despite the complexity of the problem, there are some easy things that you can start to implement. And I like to think about, like, okay, what are the one step at a time? What are the building blocks we can start to develop to tackle these problems?
absolutely.
So I think it starts with meeting men where they're at. So, if we take a look at urinary issues, for example, I look at things like, okay, what could be irritating the bladder that you're eating or drinking? What are your habits around, maybe you're overhydrating, maybe you're underhydrating. Either of those could be contributing to the issue. So we kind of look at those factors when we think about urinary health. Then when we think about sexual health, I tend to look, that's a hugely complex issue, right? But that touches on a lot of things. So I want to look at what's your cardiovascular health like? What's your blood pressure like? What's your blood sugar like? And so we may look at dietary adjustments to address any of those particular things.
Yeah.
Then when we look at digestive health, again, that's a missing puzzle piece for a lot of people. But if you're dealing with constipation, or if you're dealing with diarrhea, IBS, any of those kinds of things, that could be putting a lot of pressure on the system that could be influencing your sexual function or pelvic pain or any number of those things. So we want to address those as well.
So what I'm trying to piece this together, because it makes great sense to me. But I also know that I'm a 58-year-old man. I'm stubborn as all get out, right? Um, again, I want the quick solution. I want to figure stuff out. And it really means that, and you had mentioned this in your own life, your own journey, this humility, this humble nature, just coming at it and saying, I don't have it all figured out. And one area where I haven't figured it all out is my diet. I'm stuck in what I like to do. I'm not easily swayed. But if I come to you, and most of the men who would come to you would be coming to you virtually, and I begin to sort of lay out my story, and I'm opening myself up to that, it seems like you're going to welcome those kind of conversations. What would you say to me to just encourage me to really get a good handle on how my diet is affecting my erectile function, my pelvic health? What are the tools that I might benefit from that you can give me that would help me with that?
Yeah, this is a great question. And again, I think where I would start is sort of meeting you where you're at and figuring out, okay, what are you doing that's on the right track? So we would first start with that and say like, okay, what's going well for you? And then how can we build on that? Maybe there are some small changes that you're interested in that we could begin to tweak from there. What I find is a lot of men come to the table with a wealth of knowledge already on board. And so I try to investigate like, what do you already know? What are you curious about? What are some changes that you have already been contemplating? And maybe we start with those things. So it involves a little bit of counseling, a little bit of figuring out where your motivation is, what your readiness is to change, and then working with that, right? That's where I think having another party can be really helpful because I think we start with a lot of knowledge already. Like I mentioned, I think the things that are going to be helpful for pelvic health are a lot of things that people have been hearing that they need to do for a very long time, right? It's not knowledge. Most people know I need to be eating more fruits and vegetables. I need to be eating more plant foods. I need to eat less processed food. It's not a matter of the knowledge. It's a matter of how do I turn that knowledge into action? How do I actually implement these things? And I think that's where having another person who can listen to you, reflect that back to you, investigate where there are opportunities to make changes can be really, really helpful. So I think starting with what you love and what you're interested in. So when I'm thinking about like, okay, I know I need to eat more fruits and vegetables, right? Where do I want to start with that? Well, if I hate broccoli, don't start with adding broccoli to your diet, right? It's like, okay, let me focus on like make a list of the fruits and vegetables you actually like to eat first and start there. You want to build on success. I think that what we tend to do, and again, this may be more specific to men, is that we tend to shoot for the moon. Then when we fail, we give up, right? It's
Yeah.
like, I need to eat. If I'm going to change my diet, I'm going from 0 to 100. And then I can't make it to 100. So then I go, forget it. I'm going for a cheeseburger.
Right.
Right. So having somebody to go like, hold up, maybe let's shoot for 25 first. Then we go for 35. Then we go for 45. And as you build those successes, your confidence increases. And as your confidence increases, you begin to branch out.
I think it's a question for a lot of men. Again, that immediate solution, that quick solution, or are you in this for the long game? Is this a
Right.
long-term commitment that just requires some celebrating each gain each day? All right, today I had broccoli. I don't love broccoli, but I did it because it creates the things that you would be able to articulate quite clearly that
Right.
would
Right. Right.
benefit from.
Yeah. Yeah, it's rich in sulforaphanes, which are known to be protective for the prostate. So it's like, great, if we can implement that, fantastic. The other thing is, I don't want men to shame themselves if they hear like one food's a superfood for the prostate and they just hate that food. Like if you gag every time you eat broccoli, I'm not going to sit there and tell you to keep trying to eat it. I'm
Yeah.
going to look for other sources of this nutrient or similar things we could incorporate that you actually like. One kind of mantra that I live by, and I'm a full-time college professor, by the way, so my I talk a lot in things that I tell students because I think the college student brain is applicable to all of us, right? Like we're in that learning space of like, what can I incorporate that's easy to remember and to live by? My mantra is the best diet for you is the one you can follow. Because if you can't sustain it, there's really no point
Yeah.
because you're going to go back to what is natural and normal to you. So when I'm counseling men, and one advice I would give to them is, you can go and find a lot of things that we can chat about some specific foods that are helpful. But I think what is probably the most important tool is like sit down and write down what are the foods that you enjoy? What's my pattern look like? Start with that as your template. Don't take somebody else's diet. Like, look, I can sit here and like write you out a meal plan, and I can say like, here's Andy's 7-day meal plan,
Yeah.
and I could put down all the foods that I think you should eat. Guess whose diet that is? That's my diet. That's
Right.
not your diet, right? It sounds good to me, but at the end of the day, I don't walk in your shoes, right? I don't live in your home. I don't know, what's available to you, what's local, what your culture is, what your family history is like. You got to honor all of that stuff.
You know what you're trying to accomplish. What's the long game? What am I trying to accomplish? Not just about erectile function and pelvic health and prostate health, long-term life, long-term happiness. And that comes from not just addressing, can I get an erection by using a vacuum erection device, but can I ensure that my prostate, if I've not had to go through a radical prostatectomy, my prostate is still healthy. If my pelvic floor and health is there, all of those things, I just want to take a very big picture, holistic view of everything. And engaging somebody with your expertise is a big part of that.
Yeah, absolutely. I hear what you're saying. I think big picture too, it's just remembering that the health of your cardiovascular system supports healthy pelvic health, healthy erection, healthy prostate health. So thinking about the things that you can do to encourage healthy blood flow to that area of your body is critical. And nutrition is a huge part of that, right? It's part of reducing inflammation by perhaps it's eating less, sugar and processed foods to ease the burden of inflammation on the body. Maybe it's eating more of those omega-3s from, say, like fatty fish, for example, to help improve blood flow. So there's all kinds of things that we could get into that are very specific to this. But I think big picture, it's just thinking about that supporting erectile health and prostate health is supporting my whole person health, right?
That may be the motivation that I need to say, all right, the entire health, the whole thing, that's a lot for me. But I'd kind of
Right.
like to be able to get a good, strong erection. I'd like to good have, so I'll just focus on that. And that end
The
result
rest
is
will
I get
come. Yeah,
the other
yeah.
benefits. So whatever
Beautiful.
drives you to be healthier,
Hey,
utilize.
yeah, I said if we could use erectile health to motivate men to get healthier more broadly, then great. I mean, it is a strong motivator. And I think you may have mentioned this before. I watched one of the videos that you put out where you talked about your own story, which I think is wonderful and hugely important. And one point that you make that I tell my patients too is that your erectile function is sort of like the canary in the coal mine. Like that analogy of it may be the first thing that changes in your body that alerts you to bigger changes that are going on in your body.
Yeah,
And that could be a big scary thing, right? It could be like, oh no, this could mean that things are changing. But I want to reframe that in that it may be your opportunity to take charge of your health before things turn into something much bigger.
yeah,
We don't often get those red flags that come up that early to say, hey, something has changed. You might need to address this. So, by addressing your cardiovascular health, when this first sign starts to creep up, you may be reducing your risk of something much more serious, such as heart attack or stroke, which are among the leading killers of Americans right now. So,
absolutely. I saw it as a blessing. You know, it made me step back and make some big adjustments in my life, and I will never regret having done that. Didn't feel great at the time.
and this we put so much weight, I think, on this issue that it takes on a life of its own, right? That it's like a horse that grows five extra legs and runs off, right? It's like
Yeah,
you give it so much extra power.
yeah,
And I think one thing we can do to empower ourselves is to go like, wait, no, this doesn't mean I'm less of a person. This doesn't mean I'm less of a man. This is a common problem that people encounter. And B, this is an opportunity for me to make some changes that are going to benefit me as a whole person. So maybe
absolutely.
look at it that way. Like maybe this is an opportunity for me to take a step back and say, what are the things going on in my life? Maybe it's related to my mental health. Maybe it's my cardiovascular health. Maybe it's, there's so many factors that could be influencing this issue, but it's an opportunity to take a step back to reflect on where there's opportunity for change and improvement and to make those changes. And also knowing that there's support, that you don't have to do this alone,
Yeah.
that there are people who are dedicated to helping you with this problem.
And I think that if there's anything that I've seen over the past 8 years that I've been working with Tim Medical is that there is a heightened awareness among men. There's less feeling like I'm the only one. I'm going to hide this. There's more engagement and conversation. Men are a little more open about it, a little more honest about it. We're aware that we're not in isolation with this, and I appreciate that approach. I would like to honor your time,
Yeah.
but I would like to ask you one more question. You had mentioned sort of your personal journey to get to where you are here. So, if you could give me that synopsis, that story, I would love to hear that.
Yeah, I think it's important because and I have brought this up before in other interviews that I've done, but that, when I got into this as part of clinical practice, I was not intending to return to clinical practice. So I spent about 5 years in oncology nutrition in the first part of my career and got really deep into clinical nutrition. And it was a very difficult, emotionally kind of challenging area of practice, which I'm glad I did. I don't regret it at all, but I needed to move away from just for my own mental health. And so I got into higher education and I went down that pathway and then intended to stay in higher education, still with nutrition, so teaching nutrition, but moving a little bit away from the clinical side of things. I got into a doctoral program. And during this time in my life, my stress level was just, at a 15 out of 10, right? I was experiencing pelvic pain, which is, again, a very common issue that men can experience that they don't talk about and that they go through the ringer. I think any kind of chronic pain. So thinking more broadly, chronic pain itself is difficult to treat. There's layers of shame and, difficulty navigating the system, finding who can help you with this particular problem. That's actually how I got into this as part of my clinical practice, is that I sort of hit this crossroads of like, wait, I'm doing this clinical doctorate in nutrition. I have the opportunity to actually take my clinical journey and meld that into my own personal health journey. So that's how I found Dr. Susie in her practice, was through this complicated journey of being a patient and trying to figure out, where do I get information on how do I get better, right?
Yeah.
And so this is adjacent, I think, to probably issues that your patient population has, but chronic pelvic pain was how my journey took me here. And again, I have that humility of like, just because I did something and it worked for me doesn't mean I think, I look at every patient as an individual. It more gives me a deep empathy, and I think that's where my empathy comes from. In that I know how hard it is because I went through this journey of having to talk to urologists about my problem and having it sometimes be dismissed, or having getting treatments that didn't work, and, trying to find a solution. And it really took a whole person approach for me to get better. And I have found through my own practice and working with many different men who come from all different areas of the country with all different sets of problems, that it almost always takes a whole person approach for them too. It's not just one thing. It's like, we've got to look at you
Yeah.
broadly.
I think it makes men who work with you much more willing to be open and honest, because again, that non-judgmental, everybody's got their journey, and I'm here to meet you on your journey and then help the next step along the way. So Dr. Jason, I appreciate your time today. If people want to find you, I know you are in Texas, Dr. Susie Gronsky's in North Carolina, but they don't have to go to either one of those places to find you and reach you.
Right.
So how do people find you if they want to connect with you?
Yeah, so if you just look up Dr. Susie Gronsky, you will find her practice. And that is how you can connect with me and any member of her team, including herself and our entire multidisciplinary team. Everybody is awesome that I work with there. I can't speak highly enough of the team that I work with, the care, the compassion, the expertise that you will encounter working with them. I'm a little biased because I'm part of this team.
Well, Dr. Jason Stevens, we appreciate your time, and I will link to any way to connect with you at the end of this video and also in the description. And we're honored, and everything that you provided here, I think, is helpful for any number of the men who work with us here at Tim Medical and anybody who's considering working with us. So thank you.
Absolutely, my pleasure.
We are very grateful to have had Dr. Jason Stevens with us. If you would like to connect with him or understand more about him, you can go to drsuzieg.com. I will put that website in the description for this video. Or if you have questions, need information, you can reach us at education@timmedical.com.